everyone. Welcome back to the Speak Up Erika podcast. I'm your host, Erika, and this podcast talks about things that we're scared to talk about but should. I'm here today with my guest, Dr. Joyce Fu. Hi, Joyce.
Hello, Erika. How are you doing?
Good. How are you?
I'm doing good.
Good. Joyce and I are here to talk about chiro today, and this is going to be part of a two-part episode. So this is going to be episode 1 where we talk about chiro, and episode 2 we'll talk about yoga, which Dr. Joyce also does. So I guess first, before we get started into our topic of chiro, could you tell us about yourself and like how did you get started and being a doctor?
Absolutely. I'd love to talk about it.
Yeah.
So I started as a professional hip hop dancer. I've always loved dance since I was young, but I really got into it in second year university. I started dancing professionally with a company in Markham. They're called Vibe. And through them, I was able to perform in multiple events, like live events out on the stage, which I miss so much. And through those experiences, I learned a lot about my professional experience, but also to find out what I truly have passion for. And that was actually to feel alive, like to feel the best shape I can. And for me to do my job properly, I had to, stretch often. I had to do my self-care and things like that so that I could be on stage fully present. But then doing the dancing a lot, I trained really, really hard, and I trained in multiple teams after that. I kind of hurt myself a lot. Really serious injuries occurred where I couldn't move my arm anymore, things like that really freaked me out. I was like, this is really not good. So I started to delve into more self-care type of habits, and yoga appeared to me in my life again. And that's when I started doing more of it. And I found out there was so much to offer in that practice that I hadn't found in dance, in terms of being like able to sit with my mind and to go through the thoughts and trauma and things that I had dealt with. So from that experience, I wanted to really dwell deep into it. So I did my yoga teacher training. And at the time I was working at a chiropractic clinic. So it just made sense that I could just be a chiropractor that talked about all of these things I've done already, that gave me more structure. And it turns out that I can also be a doctor. And I was like, this is great.
So sick.
Yeah, it took me a while to go back to school, because it is 4 years and it's very, very tough. A very tough program to graduate from, but I did it and here I am. So yeah, it's been a huge accomplishment so far, and I love my job. It's great.
Yeah. Oh man, that's awesome. So from your personal experience, when you kept getting hurt from dance, did you see a chiropractor often as well?
I wasn't that I didn't actually see a chiropractor. I just worked at the chiropractic clinic, and but being exposed to it, I was like, oh, I can see how this would fit so easily into like self-care habits. And that's when I started to take more advantage of, oh yeah, chiropractic is actually pretty cool.
That's awesome. Yeah. And I know recently Joyce and I actually saw each other in her clinic, and she did a chiro treatment with on me. Yeah, chiro treatment on me.
With you? Yeah.
With me. But it was my first time doing chiro, and I didn't really know what to expect. But it was awesome to like see how you treated me and like what the root cause of the issues were, right? And I guess like a common question that maybe you get often is, how is chiro different from physio and massage?
Totally. So yeah, we are all similar in that we treat similar conditions. We also have a similar background in anatomy, physiology, all these things about your body. But I think our approach is slightly different. For chiropractors, we can also focus on wellness-based type of care. So you can come in even without, say, you have back pain or you just want to get your spine checked. we can totally help you in that instance. Whereas physios, I do know it's more of like acute care and things like that.
Mm-hmm.
In addition, we chiropractors, we are also trained to do certain types of therapy, including adjustments. So
Mm-hmm.
adjustments, we've been trained for it during our program of 4 years, whereas I know physios can kind of do an extra course on the side to learn how to do them.
Oh.
So we're a little bit more specialized in doing that adjustment. We can both learn to do acupuncture. Acupuncture is just another layer of ways to treat people. And for massage, I think massage and chiro go really well hand in hand. So most times I would actually refer to my patients to see a massage therapist when I think it's needed, and then kind of go back and forth between the two because they actually go along together really well.
Oh. And why is that?
Yeah, so for us, we focus on the spine and, of course, some of the muscles, the key muscles that are targeted. But then, say a patient really has a tight back that is harder to spend more time. That's when I would refer to a massage therapist and say, okay, get body work done for 45 minutes. And after that, I will see you again, and your body would actually hold your adjustment for longer.
Oh,
Yeah.
wow. Yeah.
Yeah. So it all depends on what that patient needs at the time. So everyone's
Right.
different.
Mm-hmm.
And also everyone's nervous system is primed a little bit differently. So say you naturally get really anxious easily, then
Mm-hmm.
we kind of need to work a little bit more with chilling out your nervous system and making it the most comfortable it can be so that it can accept this type of therapy.
That makes sense. Yeah.
Yeah.
Oh, yeah. Oh, I guess so this is kind of like a form of therapy to get chiro then
100%.
as
Yeah,
a
it's
treatment.
a
Yeah.
manual therapy. Yeah.
Right. And I know like earlier you were talking about the different type of like patients that you do see. Can you kind of like mention that as well?
Yeah, for sure. So I treat all ages, from like newborns to regular adults, I guess,
Yeah.
teenagers, adults, pregnant women, and even
Yeah.
seniors. So basically, anyone with a spine, including animals, pets, dogs, I swear, everyone should
Oh, no
have
way.
care. Yeah, 100%.
Yeah. Have you treated animals in the past as well?
So I've treated my dog. Like, I mean, she's
Oh,
Daisy is cool and stuff. So I've
yeah.
kind of treated her a little bit, and I can tell from her body language she really enjoys it. But to like officially do it to horses, to dogs and stuff like that, you do need another level of training for that.
Right.
Uh, but I just kind of tried it on my dog.
Yeah. Wow. I didn't know that. I
Yeah,
mean, like it makes sense because it's like like if you have a spine, I
yeah,
guess that's what you're referring to, then you're
yeah.
able to get that therapy, right?
Exactly. And even though they
Yeah.
can't talk to us or tell us like, oh, it's hurting here, we can
Yeah.
read body language, and you can tell like if this horse is limping on one leg, like it's probably the hip is probably sore or something. Right.
Right. Yeah. And then that's what, as earlier you were mentioning intuition.
Yeah.
Is that like you can kind of just tell from your intuition with like their body language and how they're reacting with what manual therapy you're giving to them?
Oh man. I think intuition is something that it's not really taught. You kind of have to be you have to be intuitive about it. No, I like not everyone is good at it is what I'm saying. Like I think
Yeah.
with my previous experience with dance, like it taught me a lot about the body, my body especially, and I've been referring that to everyone else in a way.
Mm-hmm.
um and I'm kind of like the moment they step in, that patient steps in, I'm already reading like how their what their expectations are, or what level of understanding do they have about their body, because that's actually the most important key, is like how connected are you to this part of your body, like literally do you feel this pain or not, because some people
Mm-hmm.
don't at all, and they're like it just hurts but I don't know why, or like,
Right.
"Yeah,
That's
like
so
it's kind of numb
common.
here but it comes and goes," and sometimes when I ask really specific questions it's like wishy-washy.
Yeah.
So like that's also a good gauge of how I have to cater my services and treatment to them too.
Right. Yeah. I don't think I've ever thought about manual therapy in that way with connecting like mind, body, and soul, I guess you could say.
Yeah,
And
totally.
that's kind of how like Joyce and I connected with the Speak Up podcast, thinking that it would be an amazing idea because I've been talking a lot about therapy, but that's like CBT therapy for the mind and stuff. And we haven't really talked, or I haven't even learned much about how manual therapy can also help
Mhm.
with your mind as well. So I guess
Right.
for yourself, like how would you say like those two kind of go hand in hand with mental health and physical
Mhm.
therapy?
For sure. So
Yeah.
my view is like mental health can, or like emotional stress or trauma can manifest itself physically in your body. It manifests physically because of like, how do I say this? Kind of like your nervous system is being blocked, or there's some type of um, barrier that's not allowing it to fully rest, fully breathe, fully eat well, and all these things. Because like when you're under mental stress, like you can't even think properly, or you can't even like
Mm-hmm.
eat. Your appetites may be off. You can't drink water. All of these things are physical manifestations, right? And
Oh.
so yeah, there's some key areas in your body. I would say like the shoulders for most people is like
Mhm.
emotionally tight, and also hips is another one.
Mm.
Hips and low back. But of course, that can vary for everyone. And so that's how I see that the mental stress can physically be in parts of your body.
Mm-hmm. And when you were referring to like different parts of your body, that's where a lot of like emotions are held. Is there certain known like your shoulders or all your sadness or something, or like your or like I know I've heard
Yeah.
of one where like if you lift your like the throat up when you lift up, that could help like speaking up and
Yeah.
like being more
So yeah,
vocal. So yes,
100%. So that's actually related to yoga, where
gotcha.
where I would talk about it more in my yoga classes and stuff like that, where like different chakras. So like there's 6 of them that line up actually along your spine. So it's like
Mm-hmm.
this is a third eye, and then it goes to throat, and there's a heart, there's a belly, and then there's a sacral chakra. So all of those need to be balanced out as well. So if one is
Gotcha.
over functioning, one is under functioning, you kind of have to balance out that energy between all of them.
Mm-hmm.
Yeah.
That
So
makes
it's
sense.
true. But in
Yeah.
terms of like the shoulder, I don't necessarily see any research saying like, oh, sadness is here. Although great concept. But the way I see it is like each person's experience of when I touch them in that spot is completely different. Right. And
Oh.
that tells me that like they're whatever is causing it or related to it, or whatever emotions tied to it, is like different for each person.
Right.
Yeah.
Yeah.
Like for some
Wow.
people, like would just touch lightly and they'll be like, oh, that's so painful. Right. Or some
Oh.
other people touch it lightly and they'll be like, I don't feel anything. It's like that's completely subjective. And to me, that's where the mind and emotion come in, because those are
Wow.
all personal experiences that you can't really express as
Mm-hmm.
easily.
Yeah.
Yeah.
Well, I guess like people who have very severe injuries that
Right.
their like their physical therapy, they're not able to heal unless like their mental is kind of part of it. No, like with them knowing
Oh,
themselves that they can like do
yeah,
it, right?
of course,
Do you
of course.
experience
Yeah.
that a lot with your patients too who are healing, I guess?
Yeah, that's a great question.
Yeah.
Um, yeah, that's why in my first visit, I always ask the patient what your expectation is. Always
Uh,
I always try to already pull it out of them, because that will already tell me how likely they are to feel better, A, and B, actually stick to their exercises too.
yeah, that's
Yeah,
true.
which are all part of the journey of healing, is how committed is that person to their healing journey. It's not just me. I'm basically guiding your body to do it, but it's ultimately your responsibility to do it.
Yeah. Yeah.
Yeah,
It's like kind of similar to, I don't know if you've ever done CBT therapy
I've heard
before.
about it, and I
Yeah.
know its place. Like I would refer to get it done to a patient if they really needed it, for sure.
Yeah. I guess like I kind of asked that question because it reminded me of Breaking Bad. Have you ever watched
Yeah.
Breaking Bad?
Yes,
And
of course.
and it's when Hank I think both of his legs like got disabled for a bit, and he had to learn how to walk.
Okay. Oh yeah. Okay.
Yeah.
I gotta watch that show again. It was
Yeah.
so good.
It was so good.
Yeah,
So, Joyce, earlier you mentioned about manual therapy. Can you kind of go into more detail of exactly what that means?
absolutely.
Yeah.
So, manual therapy basically means we use our hands to help you. So,
Okay.
there is that aspect of physical touch that occurs during a treatment. There
Right.
are some chiropractors that obviously use other types of modalities, so like an activator, so they don't use their hands.
Yeah.
So, there's different types of chiropractors, right? So, but we've all been trained to do it by hand. Initially, it's just over time, some people might adopt different types of practices. But for me, I really saw the value in someone physically touching my back. Like that
Yeah.
was actually healing to me. And that's where I think the mental health aspect also comes into play, is because we are being human beings, like we need to touch each other. Like it actually releases a certain type of neurotransmitter in our brain called oxytocin that makes us happier. And so
Mm,
the more it's being released, that happier you actually get, like your mood will actually improve. And
mm-hmm.
so that's why sometimes you feel really great after a massage, because like someone's literally been touching your back for like an hour.
Yeah.
So
Wow.
yeah, so there is lots of evidence and research behind physically touching someone else to help them feel better. um, there's another technique that's called craniosacral,
Mm-hmm.
and it's not like a very rough, it's a very gentle, like the most gentle technique I think out there right now. And it literally just like holds, for example, holds a person's head. I just
Mm-hmm.
hold their head for like, I don't know how long, but like maybe 2 minutes, maybe 5 minutes, depends
Mm-hmm.
on how they respond to my touch. And from that's when I can tell they've really, their body is understanding that what I'm trying to do.
Right. Yeah. Wow. And so I'm thinking back to like, I mean, the pandemic, which is happening right now. And do you think that a lot of people's mental health has been affected because we're not able to like hug our friends anymore or like hug our
Yeah,
families and stuff like that?
100%. Like all this virtual stuff is fine, but it's not the
Yeah.
same as like actually seeing someone, touching them, hugging them, kissing them. Like none. No, for sure.
Yeah.
Yeah.
Yeah. Even when like Joyce and I met for the first time, we're just like, oh, hi, and like hugged
Yeah,
each other, right?
exactly. I'm such a
Yeah.
hugger. Like, yeah, I'm the hugger in the family.
Yeah. And then I've heard of stories of like some people who get, I guess it could be manual therapy, like say like acupuncture, I guess, and then they all of a sudden just start crying. Is
Yeah,
that something
totally.
that has ever happened when you were doing treatment to someone? Like their
Um,
emotions just become released, I guess?
yeah, I
Yeah.
definitely, yes, with
Yeah.
adjustments, I get some of that.
Oh,
Um,
wow. Yeah.
yeah, like some people are just like, holy crap. I mean, like, can't believe how much they needed it without telling me. Because I
Yeah.
could intuitively tell, like, oh, like this needs to really go. Like this needs to move. So
Right.
yeah, my patients are always very thankful for the work I do, because it's so valuable. Like they
Yeah.
understand truly why it makes sense when they have it done, right?
Mm-hmm.
Very cool.
Yeah. um Especially like for me, I went to you for back pain, and it's
Yeah.
like something that's a pain that's always reoccurring. It definitely affects your everyday life, right?
Right? It's not just like, are you healthy or not healthy? It's how are you feeling? Are you feeling good, great, excellent? Like it's that part of the spectrum that I want to I want everyone to experience. Like everyone should be feeling amazing in their body, right?
Mm-hmm.
Um,
Yeah.
and so I think most of the medical community out there is worried about, are you dead or alive, literally. Like when they look at you, and if it's, no, I'm serious, and if it's
Yeah.
non-emergency, they won't, like, they'll just give you some medication and you're on your way. But for
Right.
me, it's like, oh no, we have tons of work here, like we got this and this and this to deal with, right? So
Mm-hmm.
it's about effective, and everyone has their place in the bigger scheme of things.
Mm-hmm. Yeah. And I love how like during our our treatment together, you really wanted to like ask about what the root cause is or find the root cause. And is that common for most chiro treatments?
Um, I that's a really great question.
Yeah. Or is it like
Everyone,
your practice?
yeah, everyone practices a little bit differently.
Yeah.
I think for me, it's again back to my story of why I became a chiropractor. It's important for me to find out or try to find out, investigate what the root causes are, because no matter how much you put a band-aid solution on things, it'll still reoccur. And
Yeah.
not about trying to fix things, like actually trying to change things for the better. I believe it can actually happen.
Yeah. And I guess like with someone, like, I mean, I'm working at a desk and I'm sure a lot of people are working from home.
Yes.
And
Oh, yes.
like even if we're doing our exercises and stuff, like because we're not as physically active, will that pain, I guess, always kind of come back in some way?
Probably, yeah.
Yeah.
What's gonna change should be your perspective on it. It should be the things you do outside of you sitting down. So like maybe on your lunch break, you actually, I don't know, go for a walk rather than just sit and eat, which is also sitting, right? Or maybe like you actually prepare your food with more nutritious food and fruits and veggies because you want better health, right?
Right.
Like these are things that everyone should desire and want and should have access to be honest. It shouldn't like differentiate any type of person from it. And yeah, I do think your perspective can change in terms of this type of pain is bad, but that type of pain of working out is good. Although they feel the same in your mind, you know that they're different causes.
Yeah, that makes sense. And like going back to you talking about your perspective of things, like some people like, oh man, well, I don't have time to do that, or like I don't have time to like go on a walk during lunch or something. But yeah, do you have like patients who are, do all your patients kind of do their exercises regularly? Probably.
I mean, I want to say probably like 90% don't.
Oh wow,
I give them yeah. Oh yeah, that's like normal. Yeah, very, very common. So I'm not surprised, but I always ask and they always know. So they're like, oh, Joyce is gonna ask. I should like do a couple right now, before I see her. It's really funny when they admit it because I know it's true.
Yeah. That's a high percent, like 90.
Oh, yeah, for sure.
Yeah.
But the point is that they need to still understand that most of it is their responsibility. That's all I'm trying to like reiterate, right? It's like I can do so much, but if you're only seeing me once a week and you have this pain every day, like you got to be doing something too. Yeah, right.
Yeah, I would say like that's all part of just like self-care for yourself, right?
100%.
Yeah. And I think that's like what people are realizing now too, that they really have to like find ways to take care of themselves. And was your clinic always open throughout the pandemic? Yeah, because it's considered as essential. Right. Yeah. That makes sense. But I know like for myself, I haven't gone to physio or massage or anything for manual therapy for almost a year now, because like I think people are more cautious of like going out to public spaces and clinics. So
for sure. And that's like totally fair. If patients, if people don't feel comfortable, I wouldn't pull their teeth to come. It's just like when you're ready, I'm here.
Yeah.
Just so you know that, I'm open, but it's up to you that step, of course.
Yeah, I was so thankful to like finally get some like manual treatment, and honestly I felt amazing afterwards. Even like just like my posture, because I know I have horrible posture, and the fact that like my posture was kind of like sideways too. So I was like, oh my god, yes, I needed this.
All I think about are the memes that are like, it went in like this and then I came out like this.
That's so funny.
It's kind of true.
Yeah, it is. It's so funny. Even I guess like with chiro, do people come in and kind of get like scared or excited because I think like right now chiro in social media is
Right.
like, you know, like the like
Yeah.
yeah.
For sure.
Yeah.
Yeah, I definitely think people, when I, just like any person on the street, I'm like, oh, I'm a chiropractor. And they're like, oh, you crack people's back? Like, I'm like, yeah, but like I do a lot more too.
Yeah.
So yeah, definitely still has like out there in society, they have a fear of like chiropractors and what we do. But I think by us talking and doing more things like this, actually getting more exposure of like what we actually do is helpful to educate everyone of you know, what, how we can help and things like that.
Yeah. What are there some other misconceptions that people have about
Yeah.
chiros that you know of?
For
Yeah.
sure. Like there's tons. Yeah, that A for sure is like we just crack people's backs.
Yeah.
B is like when we crack your neck, something really bad will happen. I think
Oh,
that's, yeah, more specific to the cracking,
yeah.
but it's so weird because people crack their own necks and stuff, and then they come in
They
to
go like,
see me, you know,
yeah, or just like, you know, like all the time, their
like all the
fingers.
freaking, yeah, and I'm like, bro, you know, like,
Yeah.
okay, you're obviously not scared. You just
Yeah.
don't want me to do it for you. Like
Right. Yeah.
it's a different kind of thing, but that one for sure. And I guess some people are still scared of acupuncture. It can be a kind of scary experience if you don't like needles, but the benefits of it are like a lot. So yeah.
Yeah. Is it a mental benefits as well with acupuncture?
You know what? The more I'm doing it,
Yeah.
the more I see the mental benefit. It because it forces a person to like meditate. It forces them to not move and to literally only breathe, like yoga.
Oh, wow. Yeah.
Right? And
Yeah.
like they can't move. So they're like, oh, the needles are gonna move. So I might as well just stay and breathe. I'm like, yeah, that's literally all you need to do. You just
Right.
chill out.
Yeah.
And that in itself is so mentally beneficial.
And it's pinpointing certain muscle points, and I guess like those muscle points do like what does that?
Yeah. So
Yeah.
part of it is muscle points, part of it is acupuncture points. So the
Oh,
way I studied it, it was like traditional Chinese medicine. So it follows certain meridians, and meridians are different than the systems that Western medicine thinks of. So like
okay.
the liver in traditional Chinese medicine is different than the liver in Western medicine. It has different
Okay.
purposes. Yeah. But basically what I'm doing is stimulating certain spots along that meridian, which is like a river flowing, if you think about it. And say you have elbow pain, so like this part of the meridian is stuck, that's when I would try and stimulate it to allow that flow to move up and down better. Yeah,
Oh,
so it's not really muscle points.
right.
Sometimes it can be, of course, if you're like, it hurts like this muscle too. Of course, I can also acu it, but there's multiple meanings of why I'm doing it as well.
Yeah. Wow, that's so cool. Yeah.
Yeah, that's
And
what I'm saying. Like, acupuncture is great.
yeah, and that technique has been around for a long time then because it's part of Chinese medicine from
You
before.
got it. So, like,
Yeah.
5,000 years.
Oh, wow. Yeah.
Yeah.
That's crazy.
It's been
Um,
adopted to be more part of Western medicine, and that's where they use mainly muscle points, trigger points to like help. Yeah.
gotcha. I get it. Yeah. And I guess going back to self-care tips, and like I know we mentioned about I forget where did we mention self-care? Getting manual therapy is yeah, as a form of self-care. And I could you share like some of your personal self-care tips?
Some self-care tips I would recommend would be to like do something from each type of category. So there's 4 categories I would recommend. And so each one is related to a different part of yourself. And it's either like the physical being, mental being, spiritual. And so all of these parts we still need to address one by one because I mean, they make up the whole of us, right? And so there's one part that say is more controlled by dopamine, which is a reward chemical. That's good if you, complete a task, for example, or you like to eat a certain type of ice cream or cake. That's more dopamine related.
I
If you do
see.
oxytocin, we talked about that. That's more the physical care and that's the
Right.
aspect. And so you can do a bath and you're like, what's the word? Scrubbing yourself or facial, things like that. Yeah, very simple.
Yeah.
Could stimulate oxytocin, which is the love hormone. And then we
Right.
have serotonin, which is a mood stabilizer, which is more important for things like meditation. If you have a low mood, then we should be doing more chill activities, things like that.
Mm-hmm.
And the last one is endorphin, which is a painkiller.
Mm-hmm.
And something like acupuncture is actually really beneficial for releasing endorphins in your brain. But other than that, like we can do something as, watch a funny movie or laugh at a comedy that you really
Yeah.
like. And so all of
Gotcha.
these things all together should create a picture that makes you feel more yourself and ultimately you being a better person.
Mm-hmm.
Yeah.
And these endorphins, are they so for manual therapy, is it mostly like oxytocin? Then that is what's released?
Primarily, yes, but
Mm.
it's also with oxytocin and endorphins together, I think.
Gotcha. Because of the also the acupuncture too that can come about, right?
For sure, for sure.
Wow. Yeah.
Yeah.
I think like for myself, when I thought of self-care activities, I never
Mm.
related them back to the chemicals
Right.
that like
Yeah.
comes up when happiness occurs, right?
Yeah,
Yeah.
exactly. So yeah, it gives you a little bit more guideline and ideas to do different things, right?
Right. Yeah.
Because if you
Wow.
do like say too much of eating cake, like obviously you're not going to feel happy about that.
True. Yeah. Like
You gotta
all of
switch
the,
it up.
especially you talked about eating nutritious foods earlier too. But it's like sometimes you can eat the cake for the
Sometimes, not all the time.
for the
Maybe.
dopamine.
Yeah, it's like the 80-20 rule. Like 80% of the time you balance, 20%, like, yeah.
Yeah. So yeah, also going back to the accessibility part with Cairo, because I know like some people, I'm like, oh, like you
Yeah.
should. I told my boyfriend after, because he came with me to the waiting room. I'm like, you have to do this because his
Oh,
back is also a little bit, he's like this too, from like gaming all the time, but
oh
also
yeah.
it's you also mentioned like office home chairs and stuff really affect it. So
Yes.
anyways, I was telling him about it and said like
Oh,
you should see
yeah.
Joyce too, like get it fixed. And he's like, oh well, like I don't know if I have that covered with my insurance and everything.
Yeah.
So is that like
Right.
that? Yeah. How does in terms of accessibility in Cairo, can you kind of talk more about that?
Yeah, sure.
Yeah.
So it's a little bit tough because we're not covered by OHIP. And I know that's like a huge barrier because most people would easily go to their medical doctor because it's covered by OHIP, but not a
Mm-hmm.
chiropractor. The thing is though, every time you see a doctor, you are paying them money through OHIP, right? So you are paying like 130 or whatever that fee is, which is pretty substantial too. You just don't know it. So when chiropractors are asking for, initial fees and subsequent blah blah blah, all that stuff, it's actually reflective of what doctors are getting for
Mm-hmm.
the work they're doing. So it's not like I'm trying to like cut a huge thing out of your paycheck to come see me. It's because that's actually what I need to do to survive.
Yeah.
So yeah, it's tough because I understand where you're coming from. Like I was in the position before too. I had no benefits. I was dancing professionally and my back was broken. I totally understand that. But moving forward, I obviously I offer certain benefits to like certain groups of people that I know, say like dancers, if I do know they really need it and I treat the team, cool, I can offer you blah, blah, blah.
Right.
Right
Yeah.
now, what I also offer is like virtual yoga, which are minimum $10 a class. And you've been to it, right? So,
Yeah.
like super awesome benefits.
Yeah.
And yeah, I know yoga is not for everyone, but I also think everyone should try it at least.
Yes.
Yeah, so I mean, $10 virtual, you don't even have to travel. That's probably the most accessible thing I'm doing right now. And
Yeah.
for every person, it's different. Like every chiropractor is different stuff. So I would try and see like your local chiropractor if they offer anything special.
That's such a good point. And
Yeah.
also, I think it's funny because my boyfriend mentioned that. He's like, I don't know if I have coverage. And
Yeah.
I like went into his coverage insurance booklet
Oh,
and stuff. And I'm like, you do have coverage. And I think one of the first things, it's like, know what you have and take advantage of that, especially if you're a
yeah.
student or like
Yes.
even some people. I think it was your receptionist.
Yes.
He was
Yeah.
like, I don't even in his previous job or something, he's like, I didn't even take advantage of it. And like,
Yeah. It's true.
yeah.
Yeah, no, 100%. There's so many people out there that have benefits. They're just like hanging out on it. It's like,
Yeah.
yeah. I
Use
think
it.
they just
Yeah.
need to know why. They need to know what we actually do and like who are these people trying to
Yeah.
come back. Yeah.
Yeah. And like how your benefits can actually help you, right?
Oh man,
So
so
yeah.
many.
Yeah. But yes, I love your yoga classes. I think when was the first time I did it was in April, March.
Oh, yeah. Yeah, yeah, yeah.
Yeah, and we had was it? No, it was Women's Day, right? Yes, it was the
Oh, yeah.
Women's Day yoga with
Yeah.
Andrea's event.
Yes, 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 yes.
Yes, yeah, Joyce led it. But after that first class, because I think for myself, when I do yoga, I choose like the easy yoga classes.
Yeah, that's fine.
And like I'll do like yoga with Adrian online, but it's like gentle or something.
Uh,
But like with your classes, it's like I'm forced to be a bit more intense and like do things
mm,
not like a little out of my comfort zone, but like is good for me.
that's awesome. Yeah.
Yeah.
I think there's this like value to having a live class. Like it does require you to show up more.
Yes.
So it's good. Everyone needs a little push, I think. And that's why I'm holding them live. So people are more accountable. When I say stretch, it's like, well, now you can come to my class and stretch too, you know?
Yeah, exactly. And I guess that goes into like aside from your yoga classes to support you in your business, or what are other ways that, because you're a local based in Toronto as well, right?
Mhm. Yeah,
Yeah.
exactly. Yeah.
I love the supporting local businesses, but
Oh,
yes, if
thank
you can
you.
share.
You totally supported me. So thank you so much. So I practice in 2 locations right now, and I also offer home visits. So like if traveling is an issue, if you have like a baby and a husband and gotta move everything, like I can come to you if that makes your life 100% easier.
Right, yeah.
Yeah. So or you can come to my clinic in Yorkville or in Scarborough, and I'll treat you there too.
Mhm.
You can find me like on IG or on Facebook. And my website. I forget my website. Yeah, my website's there. jfuchiropractic.com. And yeah.
Yeah, and your Instagram handle again.
Oh, Instagram is jfu_chiropractic, similar to the website, and Facebook as Dr. Joyce Fu.
Right. Okay. Yes. And so make sure to support Joyce in her business, because you never know how much chiro can really affect your life. Right. And even like just the yoga classes, if you don't think like you have if you don't have benefits and stuff, even just starting with something small as like her class. But also Joyce and I are also collaborating for Locals Festival. So you can also get to I think we'll be doing a yoga class on for or something movement wise in her
Probably.
set. Yeah, so look out for Joyce on our collaboration there with Local Festival.
Awesome.
And yes, thank you so much, Joyce. Thank you for doing this episode with me.
You're welcome. It was a pleasure to talk to you and to talk about all the other benefits of chiropractic that most people don't know about. So thanks for giving me this platform.
Of course. We'll see you all next week and for our second episode, and we'll be talking more about yoga.
Yeah.
Okay. Thanks everyone for listening. Bye, Joyce.